ccrehab.org.
You know, we're all breathing a sigh of relief, I think, to see the COVID vaccines doing such good in the country. But let's not forget that there have been an awful lot of people who did, in fact, get COVID. Some of them have had a difficult time, even still, recovering from the illness. And so it's very appropriate for us to highlight the work they're doing at the Siskin Rehabilitation Hospital. Amy Burba joins us this morning talking about their Caring After COVID program. Good to see you.
Good to see you too.
So, I mean, I guess that is true. I know in our family, I've not made this a secret, all four of us in our family did have COVID. We didn't really have a very difficult time, but you had referenced off camera with me, sometimes you see folks coming in with even issues with the fatigue. That does seem to be something that lingers, and you don't have to just deal with it. Y'all can help.
That's right. People who maybe had a case of COVID that was not serious enough to require hospitalization, some are still finding that they're having long-term effects like fatigue, shortness of breath, maybe even some cognitive issues with brain fog or psychological issues. And so we have outpatient services that can help with those things.
I'll talk a little bit about the shortness of breath because, again, I'll go personal with it, but it's because I've experienced it. So I'm a big exerciser. I enjoy that every day. Even once I was fine in my day-to-day just living, the idea of getting on the treadmill or going outside for a long walk was scary because I could feel something inside that made me think I was going to struggle if I attempted it. Is that something you commonly hear?
Right. So COVID affects the way that the oxygen is delivered into your blood. And so exercise is more fatiguing often than it was for people before they had COVID. And they really need to just learn how to pace themselves and, what level of exertion is okay and when they need to kind of slow down and take a rest.
You know, y'all just had your possibilities luncheon there at Siskin. Your staff is so accustomed daily to seeing what really amount to miracles in all of your patients' lives. So for people who might be coming to you for the first time with this Caring After COVID program, kind of walk us through how it works and the individual attention they get from your staff.
Right. So if someone is coming to us like after a prolonged hospitalization during which they've had COVID, they will be admitted to our hospital and evaluated by a team of therapists and rehab doctors and nurses. We also have respiratory therapy and wound care specialists. We have the whole team to look at the patient and their individual needs and determine what their plan of care needs to look like. And then we start them in their therapies and we start the process of educating them and their family about the disease process, what kind of goals are realistic for them, what to expect in terms of long-term recovery, and we work towards all those goals.
What if you are someone who has not been in the hospital? Maybe you've had a relatively mild case, but there are just still these lingering issues. Do you find that it might be a spouse or a family member who recognizes the difficulty the patient's having and not he or she themselves?
It could be, but I think more often than not, the patient will also recognize that they are just not back to the way they were before they had COVID.
And it's a day program, right? You just have your allotted time where you come in and meet for 30 minutes to an hour, and then you go on about your day?
It can be. So on our outpatient program, we have occupational therapy, speech therapy, and physical therapy, and then we also have a psychology. So it just really depends on what the patient needs. It may be that they, only need physical therapy, but if they need all three therapies, then we'll, determine that and schedule those appointments for them.
Okay, and so is this something too where they're self-referring, or do they have to go through their primary care doctor or a specialist who sends them your way?
Generally speaking, we need an order for therapies. However, we do accept patients through direct access for physical therapy. So they can refer themselves for PT. And then, PT can help determine if they need other therapies and help them get those referrals.
I'm peppering you with questions this morning, and I'm sorry to do it, but I'm guessing that y'all are also getting peppered with questions when people are coming in to see you, because there are so many unknowns still about COVID and how long these side effects are going to continue. You have referenced a couple of times the psychology, and I know you mean it from the mental fog that can be an issue for people. But I would think that there's a counseling, a comforting counselor role that y'all are taking on for people too.
Yes, and seeing especially our patients who had prolonged hospitalizations, working with our neuropsychologists and psychologists, they are doing what we call adjustment counseling. So, there's a lot that goes along with being in the hospital for a long time, and also during this time, patients being separated from their families while they're recovering. There's been a lot of fear, so that's important.
There has been, for sure. So it's very typical, I would say, Amy, but wonderful nonetheless that y'all have developed this program and want to make sure that people know how to access it. Thank you so much for your time this morning.
Thank you.
As you would expect, this is all at the Siskin Rehabilitation Hospital, Chattanooga's treasure for sure. Their website is siskinrehab.org. Their phone number is 634-1200. Except for the physical therapy part, which you can directly access yourself, you will need to have a referral from a physician. But you can just talk to your doctor, ask about the Caring After COVID program they have going on at Siskin Rehabilitation Hospital, and see if it's something that can benefit you on your road to recovery. We're back after this.